the management of chronic pancreatitis. Welcome to the Everything Surgery podcast, where we explore complex medical topics in depth. Today, we are discussing the management of chronic pancreatitis, a condition that demands a thoughtful, multifaceted, and lifelong approach. Our goal is to provide a clear understanding of the strategies that guide care for individuals with this challenging disease. Understanding chronic pancreatitis. Chronic pancreatitis is a progressive and irreversible inflammatory disorder affecting the pancreas. Over time, the ongoing inflammation leads to permanent destruction and scarring of pancreatic tissue. This results in two principal clinical consequences. First, there is a failure to produce digestive enzymes, which causes malabsorption, symptoms like fatty stools, and weight loss. Second, there is a loss of the hormone-producing cells, leading to a unique form of diabetes sometimes referred to as type 3C diabetes. Unlike acute pancreatitis, where the focus is on resolving an immediate crisis, managing chronic pancreatitis is about long-term control of symptoms, preventing complications, preserving quality of life, and slowing down the progression of the disease. Key goals in management. Effective management revolves around 5 central objectives: modifying lifestyle and removing triggers such as alcohol and tobacco use, controlling pain in a structured and safe manner, addressing the failure of the pancreas to produce digestive enzymes, managing the loss of hormone production, especially insulin, identifying and treating potential complications as they arise. Step 1. Lifestyle modification and removing triggers. This is the foundation of management, aiming to prevent further damage and slow the disease's progression. Complete abstinence from alcohol is essential, as continued consumption is strongly linked to worsening pain and complications. Support from addiction services is often required to achieve this. Tobacco use is another major risk factor, and cessation is equally critical. Dietary changes are recommended, with small, frequent, low-fat meals often helping to minimize pain after meals. Individuals should work with a dietitian to maintain balanced nutrition and address any deficiencies. Step 2. Pain management. Pain control can be one of the most difficult aspects of care, and it requires a gradual approach. The initial step involves using medications such as acetaminophen and nonsteroidal anti-inflammatory drugs, which help minimize the risks associated with stronger painkillers. If pain remains moderate to severe, weak opioids like tramadol or codeine may be introduced. Stronger opioids are reserved for those who do not respond to other therapies and must be used with caution due to the potential for dependence and increased sensitivity to pain. Adjunctive medications, such as pregabalin or gabapentin, can be helpful for nerve-related pain, while certain antidepressants not only address neuropathic pain but may also improve sleep quality. When medications fail to provide adequate relief, interventional procedures such as endoscopic therapy or nerve blocks may be considered. In select patients, surgical procedures like drainage or partial removal of the pancreas can offer significant relief, with the most extensive surgery, total removal of the pancreas followed by autotransplantation of insulin-producing cells into the liver, reserved for those with the most persistent and severe pain. Step 3. Managing digestive enzyme deficiency. When the pancreas no longer produces enough digestive enzymes, patients experience malabsorption, weight loss, and deficiencies in essential vitamins. Treatment centers around pancreatic enzyme replacement therapy, which involves taking specially formulated capsules with every meal and snack. The dosage depends on the amount of fat in the diet and the severity of enzyme deficiency. Success is measured by improvements in symptoms, weight gain, and overall nutritional status. In addition to enzyme replacement, individuals are encouraged to eat a normal fat diet as long as they are taking the enzymes. Further support includes high-calorie supplements and vitamins such as A, D, E, and K. Step 4. Managing hormone deficiency and diabetes. The diabetes that develops in chronic pancreatitis is unique because both insulin and glucagon production are affected. This creates a complex situation, as malabsorption and unpredictable food intake can lead to swings in blood sugar, with an increased risk of both dangerously low and high levels. Insulin therapy is the mainstay of treatment, and simpler regimens are often preferred to minimize the risk of low blood sugar. For those with resistance to insulin, the medication metformin may be considered, but many other oral agents are avoided due to potential side effects and risks. Step 5. Identifying and treating complications. Several complications can arise in chronic pancreatitis. Pancreatic pseudocysts, which are fluid-filled sacs, may be monitored if they do not cause symptoms, but those that become painful, infected, or grow larger require drainage. Scarring in the head of the pancreas can lead to blockages in the bile duct or the first part of the intestine, sometimes necessitating stents or surgical bypass procedures. Blood clots in the vein near the spleen may result in bleeding and could require removal of the spleen. Importantly, individuals with chronic pancreatitis have a higher risk of developing pancreatic cancer, and any new symptoms such as a mass, worsening pain, or jaundice should prompt immediate investigation. Conclusion: managing chronic pancreatitis is a complex, lifelong journey that involves a dedicated team of specialists, gastroenterologists, pain experts, endocrinologists, dietitians, surgeons, and radiologists. Success depends on maintaining abstinence from alcohol and tobacco, using a structured approach to pain management with early consideration of procedures or surgery, aggressive enzyme and nutritional support, careful monitoring and treatment of diabetes, and vigilant screening for complications. Thank you for joining us for this episode. If you found this discussion helpful, please like, share, and subscribe for more in-depth explorations of surgical and medical topics. Stay tuned for more on the Everything Surgery podcast, where we continue to dissect the extraordinary.